and welcome to Caribbean TV. I'm Sharon Levy. I've had the wonderful opportunity of sitting down and speaking to one of Jamaica's finest doctor. Dr. Dale Abel is currently an associate professor of medicine and biochemistry and an investigator in the program in human molecular biology and genetics at the University of Utah School of Medicine. Ladies and gentlemen, Dr. Dale Abel.
Very proud of my heritage. I'm very, very proud of being from the Caribbean and being from Jamaica. I think that, and this is something which is not necessarily completely understood within North America, is that in the Caribbean, I believe that we have a very solid and rigorous educational system, which I think really prepares us very well to excel on the world stage. So I have no disappointment in a sense in having gotten my basic education and basic training there. There were challenges, of course, moving into another system because the systems of education are somewhat different in North America than they are necessarily in the Caribbean. However, I think that one of the things that you also learn going to school in the West Indies is really how to be a good, I should say, a fast study. So we learn how to size up the circumstance in which we happen to find ourselves and figure out exactly what it is that we need to do to be successful. So I felt really quite prepared for the transition.
Dr. Abel, let's go back to Jamaica and start with high school. Tell us a little bit about Jamaican high school and take us back to where we are today.
Sure. So I went to Woolmer's Boys School, which is one of the oldest high schools in Jamaica. To get into Woolmer's, which is probably the case now, you had to take an exam called the Common Entrance Exam. I spent 7 years there, from first through sixth form, and the main thing I was involved in, I guess, as a student was I was on the school's quiz team, which is a TV show that we actually won 2 of the 3 years I was on the team. I was deputy head boy at the time I graduated, and then I went on to the University of the West Indies. To get into university, one had to take these tests, which are administered by the University of Cambridge, which we call the advanced level examinations. Yeah. So based on my grades in that, I was awarded a scholarship, which is called the Jamaica Scholarship, which essentially got me directly into the University of the West Indies Medical School. Medical school was a 5-year program, quite rigorous, fair amount of work. The first 2 years mainly studying about the nuts and bolts of the scientific background of medicine. The last 3 years was more sort of hands-on, actually learning how to speak to patients, diagnose their conditions, etc. I did fairly well in medical school in that I was the first student in the history of the school to be awarded the degree with distinction. So prior to that, the degree was with honors or pass. And because I'd gotten sort of distinctions in most of my courses and exams, they created a new category. Subsequently, a number of other students have done that. Then when I finished there, we all have to do some amount of service within the Caribbean after we have our degree. And so I did 6 months at the University Hospital of the West Indies in Kingston, 6 months at Spanish Town Hospital, and then 6 months at Port of Spain General in Trinidad. During that time, I applied for and received a Rhodes Scholarship, so that allowed me to go up to Oxford University. And the main motivation for going up to Oxford was that medical school was good. It was more learning what other people told you needed to learn, or what the textbooks had. And I was very curious to try to understand how do things actually get into the textbooks in the first place. Okay. So that was really my main motivation for going on to do doctoral training in research, because I felt that that was really important for me to understand how to ask a question and how to try to get to the solution.
Where you are today, let's elaborate a little bit about where you are today.
So there are a few more steps before I got to that point.
Okay,
just quickly run through. So having finished in Oxford, got my PhD there, then I still had to do specialty training. So I trained in internal medicine, and I was fortunate to train in internal medicine at Northwestern University in Chicago. And after I finished my residency there and served a year as what they call the chief resident, then I went to Harvard to specialize in endocrinology and diabetes as a specialist, and stayed there. That training lasted 3 years, and then I stayed on the faculty at Harvard for another 5 years before being recruited out to the University of Utah to establish a diabetes research program.
I see, which is where you are. I want you to explain to us in layman's term exactly what it is that you do now at the University of Utah.
So I wear multiple hats at the University of Utah, so I'll just sort of describe the different hats that I wear. Okay. So the first hat I wear is that I'm a attending physician at the university, and as the director of the endocrinology division, I have overall responsibility for a group of other physicians and researchers whose primary focus is taking care of patients with diabetes and other hormonal or metabolic disorders. In addition to that, I spend a fair amount of my time directing a large research program that is focused on understanding the link between diabetes and heart disease. As you might know, diabetes is a growing epidemic worldwide, and particularly true in developing countries. And heart disease is the major cause of death in individuals with diabetes. And there's a lot that we still don't understand as to what it is about the diabetic context when somebody has diabetes that now puts their heart at risk in terms of heart failure. So that's what we're doing on the research side. And what we're really trying to do is to understand at a very basic and fundamental level what goes wrong in the heart. And to keep it sort of simple is that you can think of the heart as a muscle, which is always contracting. And for muscles to contract, they have to both make energy and use energy. And it turns out that one of the things that happens in diabetes is that there's a part of the cell which is called mitochondria, which are little subcellular fragments that make energy. And the energy, sort of the gasoline of the cell, is something called ATP. And we have found and discovered that that is defective in the diabetic heart. So in my research group, we're not only sort of trying to make new knowledge, but it also has been a wonderful venue for training other young people who are interested in a career in research. So I felt very fortunate and gratified to have trained really colleagues at all levels. I have trained undergraduate students who have subsequently gone on to medical school, who have come in the lab and done research. I've trained PhD students. My first graduate just got into one of the residency programs at Harvard, so I'm particularly proud of him. And then I've also trained people who already have PhDs who want to come to get advanced training in research. And again, one in particular now is just started her own independent research career. So it's been very, very gratifying being a mentor to multiple generations of individuals who seek to become diabetes researchers themselves. The other thing I would say as well, which is very interesting, because when people think of Utah, they think of an unusual place in the middle of the desert somewhere. And it turns out that my lab has actually had and hosted whether students or postdoctoral trainees really from every continent in the world, with the exception of Australia at the moment. But I've had students and trainees from South America, Asia, including China, India, Korea, North Africa, Europe, France, Germany, Spain, plus of course students from North America as well. So it's really a melting pot in many ways. So the couple other quick hats I wear, I also direct medical student research at the university, and I do teach medical students as well, both at the bedside as well as in more conventional ways. So that's a quick summary of what I do at the University of Utah. More broadly speaking, on the, so I guess the more national scale, I serve on a couple of federally funded or national panels for research. So the National Institutes of Health which funds much of the research that takes place in the United States. They have various review panels where we decide on which research is most meritorious and should be funded. So I serve on one of those panels, and I've also served on other panels that are more geared towards national programs to increase the access of medical students to research.